Hi there, I'm Dr. Cecilia DiMartino, naturopathic doctor at Willow Wellness Clinic in Waterloo, Ontario. This is a series of videos that I'm doing, about 6 parts. This is part 2 of 6. This is about pregnancy, being pregnant, having a baby, specifically in the Kitchener-Waterloo area. I am going to be talking, this video is about supplements in pregnancy and what to take. So the first video was about, you're pregnant, now, what are the first steps? And now that you're pregnant, it would be a good idea to, especially if you have benefits, it is a good idea to consult with a naturopathic doctor because as a naturopath, we can, take your case history, look at your blood work, and make really good nutritional recommendations as well as supplements. Specifically, I'm going to be talking about prenatal vitamins, which of course are the most well-known, most common supplement to take in pregnancy. So your family physician can actually write a prescription for prenatal vitamins. So one of the most common brand would be, for example, Pregvit. And the pros of having a prescription, I guess, from your family doctor is that, especially if you have a drug plan, a lot of it can be covered, and so you're not going to be paying much for the supplement. However, you kind of get what you pay for is the truth of the matter. These are some things to look out for when you're trying to select a prenatal vitamin. First of all, you want to read all the ingredients, not just the medicinal ingredients. So these are all the vitamins and minerals that are in your vitamins, in your prenatal supplement, but also what's called the excipients or non-medicinal ingredients. These are added ingredients that they put into supplements to make it look pretty, look pink and blue, it's often these are tablets, so they don't want the tablet to stick in the machines, so they add lubricants to that. Often there are ingredients like sodium lauryl sulfate, which is actually a soaping agent that we often want to avoid in our natural product lines, like shampoos and creams and stuff like that. There'll actually be signs, and even our soaps that'll say SLS or SDS free, but I often see these in prenatal vitamins or multivitamins and things like that. So check the non-medicinal ingredients. If you see talc, if you see yellow number 5 and green number this or blue number whatever, these are all coloring agents, added stuff that in my opinion, shouldn't be in there. You don't need them. Controversy on whether they cause more harm than good. Obviously they're in small quantities, but just something to think about. Then when we move on to the active ingredients, now we're looking at the amount as well as the kinds of vitamins and minerals that are in the supplement. So the B vitamins are really important for pregnancy, specifically folic acid. However, the best form of folic acid is not just folic acid at 1 to 5 milligrams a day. In fact, you want the active form of folic acid. So you want the form that's sort of activated. It's much easier absorbed. You don't have to convert it in your body for those that have a genetic issue with it. So the kind that you're looking for is something called 5-methyl tetrahydrofolate. So you want to look at the folate form is superior, as well as different B vitamins. So, things like vitamin B6. So pyridoxal 5-phosphate, so P5P is already active versus pyridoxal hydrochloride. So you want to read the B vitamins, and again, that's why talking to a naturopath and reviewing what you have is going to be a good idea. But ideally, the B vitamins are in their active form. Vitamin B12, for example, is in the methyl cobalamin form and not cyanocobalamin. These are just better absorbable forms of the vitamins that you would want to look for. And then when it comes to the minerals, so for example, calcium and magnesium, if your supplement is calcium carbonate or magnesium oxide, these are not very well absorbed. They're cheap, of course, but you kind of get what you pay for, and it's better to get something that you're going to absorb and utilize, and for your health and for the baby's health. Some other ingredients that are important in prenatals. Iron, of course, very common deficiency in women. The baby will suck everything out of you. Will take your iron, will take your calcium, all of it, and the body will prioritize the baby, leaving you deficient often. So, getting a good non-constipating iron or a supplement, a prenatal vitamin that has iron in it that is better absorbed and non-constipating is definitely key. Other ingredients that are maybe a little bit less well known are, for example, iodine. So there's research iodine showing that really helps the development of the brain. And vitamin K2. So vitamin K2 helps the calcium to actually go into the bone. So the development of the bones of the baby, the teeth of the baby, the jaw of the baby, that type of thing. So vitamin K2, ideally in the MK7 form. I know it sounds really complicated, but these are some things that I look for when I'm choosing a prenatal vitamin. And then lastly, something that's not usually sort of with your prenatal together, but often you'd want to take sort of in adjunct as an adjunct in addition to, is omega-3s. So omega-3s, traditionally fish oil is what that is, and there are two main components. So there's EPA and DHA, and these are the omega-3s that you want to be taking for the development of the baby's brain, for mom's brain, all of that stuff. These are good fats, basically. And you want to, if you can get 1,500 milligrams of combined EPA and DHA a day, that's really, really good, or more is good too. But these are some of the supplement or things to look out for supplements and what to take. And then lastly, vitamin D. So vitamin D is often, part of your prenatal vitamin, but how do you know how much to take? So getting your vitamin D levels tested, and in one of my videos I'm going to be talking about lab testing more thoroughly, but I recommend you get your vitamin D levels tested and then take an appropriate dose, again talking to your naturopathic doctor for that recommendation. So when you're thinking about supplements during pregnancy, quality in my opinion is key, and how well you're absorbing things, also how well you tolerate it. There might be some type of prenatal vitamins that are not very well tolerated. They may cause more nausea. I mean, we don't want that, obviously, but something that you can tolerate and take and feel good about, and that your body actually utilizes, is going to go a long way there. And of course, talking to your naturopathic doctor about this in more length and in more specificity is always a good idea. So hopefully this was helpful, and hopefully you'll be able to enjoy the other videos as well. Thanks. Have a good day.